Sorry for the mishap last time. So I am Madhurima Kumar from AIOC Kolkata, and I will be presenting a topic on Serratia, marcescens, endophthalmitis, the curious cases of pink hypopyon. So what is Serratia marcescens? First, it is a gram-negative opportunistic nosocomial pathogen which is aerobic belonging to the Enterobacteriaceae family. What is important about it? It is capable of producing a pigment known as protegiocin, which ranges in color from dark red to pink depending upon the age of the colonies. It is a rare but devastating cause of endogenous endophthalmitis due to its ability to produce beta-lactamase, which suppresses the use of many broad-spectrum antibiotics. Now, the rapid advent of anti-VEGF agents to treat multiple retinal pathologies, as we all know, has resulted in an increase in complications as well. So, coming to my cases. My case 1 was a 58-year-old male who presented on post-op day 2 of intravitreal injection aflibercept. He was a known patient of type 2 diabetes mellitus. His chief complaints were pain, watering, discharge, and blurring of vision in the right eye. On presentation, his visual acuity was hand movement with PR accurate. As we can see here, he had a sluggishly reacting pupil with microcystic corneal edema. The slit lamp examination showed a pinkish red hypopyon. There was grade 4 vitritis on fundoscopy. An ultrasound B scan revealed clump of exudates, which is suggestive of endophthalmitis. So what did we do? We performed aqueous and vitreous tap with simultaneous intravitreal injection of ceftazidime and vancomycin. The culture from the both aqueous and vitreous tap revealed growth of a pigment-producing Serratia marcescens. As you can see, it is bright red in color on nutrient agar. And these were the biochemical tests performed, which revealed it was Voges proscure, urease, and citrate positive, and hence it was a strain of Serratia marcescens. Coming to my second case, a 68-year-old male presented on post-op day 1 of left eye intravitreal injection ranibizumab with pain, watering, sudden loss of vision in left eye. His visual acuity was PL only. As we can see here, the anterior chamber was full of debris, pupillary membrane, fibrinous exudates, corneal edema, and there was a hypopyon which gradually changed color. So we performed a vitreous tap with intravitreal injection of ceftazidime vancomycin, and pars plana vitrectomy was performed, but to no avail. As we can see, cornea was melted. On the evisceration specimen, we found a growth of Serratia marcescens. In case 3, a 64-year-old female on post-op day 2 of intravitreal ranibizumab presented with pain, swelling of lid, and sudden loss of vision in the left eye. Her visual acuity was hand movement with PR inaccurate. There was circumciliary congestion, anterior chamber was full of cells, flare with pink hypopyon associated with severe vitritis. We performed vitreous tap, aqueous tap, and sent for routine biomicroscopy. The culture revealed growth of Serratia. Here we applied fortified amikacin 2.5% drops hourly, and pars plana vitrectomy was performed. Coming to a summary of the outcomes, we found in case 1, the retina was severely necrotic and friable during vitrectomy. The final visual acuity remained FCCF at 3-month follow-up. In case 2, the PL was lost 2 days post-vitrectomy with subsequent corneal melting. The patient underwent evisceration with eventual socket reconstruction. And in case 3, the visual acuity remained PL-PR post-vitrectomy. The affected eye was found to be thiazical after 3 months. So, what are the discussion? The known causes of pink hypopyon are Klebsiella, herpes simplex zoster, and Serratia. This protegiocin and its synthetic derivatives have been found to have very specific and potent immunosuppressive activity. Serratia infections are most commonly confined to the respiratory tract, urinary tract, surgical site infections, and soft tissues. This red pigment has been identified in keratitis, tooth abscess, and in the urine of urinary tract infection patients. What can be concluded from microbiological assessment of this family is that it responds to aminoglycosides and fluoroquinoline with moderate response to ceftazidime, imipenem, and meropenem. In conclusion, we can state that acute endophthalmitis with pink hypopyon is a rare clinical presentation indeed. Serratia endophthalmitis, as has been quoted in several literature, has extremely poor visual prognosis despite early vitrectomy. In light of the potential severity of ocular involvement by this organism, a characteristic presentation should suggest Serratia marcescens and prompt aggressive as well as adequate therapy. Here are my references, and thank you for your patient hearing.
Good presentation. So all these 3 cases, did they happen on the same day or they are like different days?
They were in a different timeline. Actually, it was not just 3 cases. We, after the first case, we tried to accumulate cases of pink hypopyon, but as you know, it's probably due to microhyphema in many cases. So we analyzed samples in only the studies where we got positive growth we have supplied in this case series.
So this was a retrospectively, you looked at the microbiology register and found these 3 cases.
The first case when it happened, we had sent the sample immediately, and after that we sent all cases for the samples, but only the positive cases I have given in this series.
So could you, from these three cases, could you give a list of, say, risk factors which could have led to this Serratia infection?
Ma'am, as I have read in literature, this Serratia, it is a nosocomial pathogen, and it is most commonly found in anything that has water in it. So it could be due to our BSS or something else. We did not do a hospital study, that is, we have not taken hospital swabs, so I cannot say from where exactly it has come. But in type 2 diabetes mellitus, patients were the most common patients who came with this Serratia marcescens. So we can say that it might be a risk factor, as well as proper sterilization. And since I have not done a hospital swab study, I cannot say from which source the infection has come.
And also the culture sensitivity report for all these three patients?
Yes, that was sent to microbiological department. What the microbiology professor told me is that it is found in plants and it is a most common plant pathogen. She asked me, did you have any plant contamination or something in these patients? So none of the patient provided positive history for any plant contamination.
No, I mean, what was the antibiotic sensitivity for these three
Antibiotic
strains?
sensitivity, it was sensitive to fluoroquinolone group in some aminoglycosides like amikacin. Levofloxacin was sensitive in a few patients. Imipenem, meropenem was, it came as moderately sensitive in some of these cases.
Did you check for linolazid?
Linezolid, yes sir, we tried, but there was, I was told that I cannot make 45 drops out of linezolid, so.
We can. I'm interested in what duration it has happened, these three cases.
It was over a long time,
wait.
sir.
The second question is that how many cases of cataract surgery or injections are the base for these cases? And third is, you said some endophthalmitis has happened during that period. What is the number of those endophthalmitis where you have not get the positivity?
So there were three cases.
Hmm.
I will go from the first question, sir.
Yes.
So your first question was that
The
what
time
was
period,
the time period?
time period, yes.
I found these three cases. I collected these three cases over a 2-year period almost.
2 years period. Okay.
Uh,
How many cataract surgeries happened during these 2 years?
Sir, I am
Plus
from,
injections, yes.
sir, I am from AIOC Kolkata. We have,
Wherever you are.
I have not calculated the entire list.
You are in
but,
India and you are part of AIOS. The
from
procedure
what I
should
know
be
from my
stringent.
administrative study for 1 year, since I have calculated that list, there were 18,803 operations in total
Mm.
in 1 year duration.
Mm.
So if I can multiply that in a 2 year, it will be 36,000. So out of that, only 3 cases I have got as positive.
No, you said another statement that
Yes,
there
sir.
are several endophthalmitis cases, but this has grown positive. That's why
Yes,
I am presenting.
Sir, the endophthalmitis cases were not all from our department. We have been referred cases.
Achha, these three are from your department.
No, one case was from referred, sir. The second case which I showed, that was a referred case from outside. The other 2 cases
That
were
clarity
in our
you need
department.
to give in your presentation.
So
That
what
is
sir
number.
is trying to find out, is there any incidence of cluster
Yes,
endophthalmitis?
I've understood,
So
sir.
that's what your timing, time
Yeah.
period, everything is important.
Yes, sir.
And also,
But
are
it
they somehow
was-
related, all the cases?
Yeah, it was not a case of cluster endophthalmitis
And
as
it
far as
appears
I
to be very poor outcome.
Yes, very, very.
What are the reasons for that?
So as I have read that first thing is we cannot detect Serratia very early since culture takes at least 48 hours and the organism seems to have a very aggressive role in endophthalmitis. Like I showed in the second case, the patient underwent melting within 2 days. In the third case, possibly I cannot attribute it to that, but possibly the patient was not diabetic and we started her on fortified amikacin having read from previous literature. So maybe her PLPR was and her eye was saved as such, but the visual acuity and the outcome was poor.